How long does it actually take to become a medical assistant?
You've Googled this. You got 6 different answers. Some said 6 months, some said 2 years, and none of them actually explained the difference.
So here's the straight answer, broken down by path.
So you can stop guessing and start deciding.
There are 3 ways people become medical assistants.
Path 1, Certificate Program, 7 to 8 months. This is the fastest, credible route. You cover clinical skills, administrative training, EHR, and complete a hands-on externship. No general education requirements, no electives. Everything is focused on doing the job. Path 2, Associate Degree, 2 years. Same core MA training, but packaged inside a full college degree program. You'll take general education courses alongside the clinical content. The degree can help if you're planning to move into healthcare management down the line. But if your goal is to start working as an MA quickly, 2 years is a long runway for a role you could be doing in 7 months. Path 3, On-the-job training. Unpredictable. Some smaller clinics still hire and train people on the floor. It still exists, but it's becoming rare as more employers require certification up front. And you'll likely need to sit for a certification exam eventually regardless. So, without structured training behind you, that exam gets harder. For most people who want a fast, clear, credible path, the certificate program is the answer.
This is what most program websites don't show you clearly.
A good certificate program runs clinical and administrative training at the same time, not one after the other. On the clinical side, you're learning vitals, patient history, blood draws, injections, EKGs, specimen collection, and how to assist during procedures. On the admin side, medical terminology, electronic health records, scheduling, insurance verification, and billing basics. And then there's the externship, real hours in an actual clinical setting, a doctor's office, a clinic, doing the job before you graduate.
At CCI, that placement is arranged for you. By the time you finish, you're not just certified, you've already worked.
The program timeline is fixed. What isn't fixed is when people start. The thing that delays most people isn't the coursework, it's waiting for the right time, for more certainty, for something else to work out first. The math is simple.
Someone who starts this month is certified and job ready in 8 months.
Someone who waits 3 more months gets there 3 months later. The program doesn't get shorter the longer you think about it.
So here's the answer you came for.
Certificate program, 7 to 8 months, focused, fast, and designed to get you working. Associate degree, 2 years. Better for long-term academic goals. On the job, unpredictable, and increasingly rare. CCI's online medical assistant program runs 7 months. Fully online, live weekly classes, externship included, job placement support after you graduate. Link is in the description. The timeline just got a lot clearer.